British researchers seem to think preventing a second wave of coronavirus could be as simple as wearing a face mask. Scientists studied the effect of people wearing masks combined with periods of lockdown and the virus's reproduction rate. They found wearing masks in public was twice as effective at lowering the reproduction rate compared to only wearing masks after symptoms appeared. The reproduction rate also slowed down if at least half the population wore the masks regularly.
So we're joined now by Dr. Todd Ellerin, who's the Director of Infectious Diseases at South Shore Health. It's great to see you, Doc. Right off the top, what about that? What do you think of that? Is it as simple as wearing a mask? What do you think?
Okay, so I don't think it's as simple as wearing a mask, but I think masks are extremely important. We've seen this now in multiple studies. I think masking for more than one person, universal masking, along with hand hygiene, not touching your face, that's part of the COVID prevention bundle. It is a bundle, though.
And Dr. Ellerin, we've been talking a lot about the increased numbers. We saw what happened with the stocks today. In more than 20 states, cases are rising. Is this a second surge or is this something else?
Yeah, this is really concerning, Erica. I mean, I think we know that there's COVID-19 in the United States. There's over 20 states where it's on the rise. We're hearing in Texas, for example, that they're almost near capacity in certain hospitals. Think of what that's like, not only for other COVID patients, but what about all the non-COVID patients that may need to come in? We need to be extra vigilant in the states that have rising COVID. We have to use those infection control methods, social distancing, stay-at-home guidance, still very important.
So do we link those surges directly to the reopening of the states, Doctor? Do you think so?
I mean, I think it's hard not to, right? The opening of many of these states were a few weeks ago. Now, there are certain states that we've heard that have opened even more than several weeks ago where that curve is still flat. So it may not be the only thing, but I think it's really important. The more we open, the more cases we will see.
Well, some good news we've been hearing is on the vaccine front. We know that Cambridge-based Moderna, just one company that's going to be going into the final stage of study for its vaccine, enrolling some 30,000 people. It seems to be moving quickly. What does this all say to you?
Yeah, well, I mean, this is good news in that they're designing the trial so the phase 2 and the phase 3 studies were back to back. So first the phase 2 open and then shortly after the phase 3. Remember, phase 3 is where we're going to see, is it effective? Is the vaccine effective versus placebo? The other thing that's happening is they're doing at-risk manufacturing, which means they know the dose right now and they're going to be manufacturing lots of vaccines. So if in fact it works, we'll be ready. It's smart strategy, and hopefully we have an effective, safe vaccine. That remains to be seen.
So we have talked about this before, but it's worth revisiting. Explain how this vaccine is different than, like, the generic flu or typical vaccines that we might get.
Okay, so with the flu vaccine, by the way, that's the #1 vaccine that has the most number of vaccines delivered to us, about 100 million. Keep that in mind. We use parts of the virus, so different proteins that are on the surface. Okay, so with the new vaccine that they're making at Moderna, it's a messenger RNA vaccine, which means they're using genetic material to get into the cell, and then our cells actually are programmed to produce that protein, that spike protein, at which we know that we can generate an immune response. So very different. The good news about the messenger RNA type of vaccines is you may be able to scale it up at a much greater rate than with the other protein type vaccines.
Dr. Ellerin, it's great to see you as always. Thank you.
Good to see you guys.